U.S. regulators on Friday authorized a third dose of COVID-19 vaccines by Pfizer and Moderna for people with compromised immune systems. Less than 24 hours after the FDA gave authorization, an advisory panel to the CDC voted to recommend the booster shots, and the agency's director signed off on it. According to a CDC spokesperson, immunocompromised individuals can begin receiving the booster shots immediately. Mixing of mRNA vaccines is permitted for their third shot if the original vaccine is not available. And according to CDC officials, patients will not need a prescription or the sign-off of a healthcare provider in order to prove they are immunocompromised and receive the additional dose. CDC Director Rochelle Walensky on Thursday told reporters the vulnerable group makes up less than 3% of U.S. adults.
Emerging data show that certain people who are immune compromised, such as people who have had organ transplant and some cancer patients, may not have had an adequate immune response to just 2 doses of the COVID vaccine. To be clear, this is a very small population. We estimate it to be less than 3% of adults.
The FDA's decision does not apply to people who received the 1-dose Johnson & Johnson vaccine, the CDC said, because there's not enough data to support additional doses yet. The FDA's acting commissioner said others who are fully vaccinated do not need an additional dose right now. Scientists are still divided over the broad use of COVID boosters among those without underlying problems. They say the benefits of the boosters remain unclear. But reports of infections among fully vaccinated people and concerns about diminishing protection have spurred some wealthy nations to distribute booster shots, even as many countries struggle to access a first dose.